All right, we're diving deep today into the American Diabetes Association's 2025 Standards of Care in Diabetes. Think of it kind of like the playbook for how healthcare pros are going to be tackling this complex condition in the coming years.
Yeah, and you know this deep dive is tailored for you. Really helps you grasp what's on the horizon for diabetes care.
Exactly. Whether diabetes touches your life personally or you work in healthcare or just, you just want to be incredibly well informed, we're going to unearth the most important takeaways.
Yeah, the stuff that really matters. And one of the key concepts that emerges is population health. Might be surprised to learn that it's not just about statistics. It's about how those numbers translate into real-world impacts on people's lives.
So it's not just about individual patients, it's about zooming out and seeing the bigger picture.
Exactly. Imagine this, you're looking at an entire forest, but you're also paying attention to the health of each individual tree. That's population health in a nutshell. It's about recognizing that individual care is crucial, but so are the larger systems and policies that influence people's lives.
And that leads us to the current state of diabetes care in the U.S. The report paints a picture of progress, but there are some areas where we're still falling short.
One of the most striking findings is that only about half of adults with diabetes are actually hitting their A1C targets.
Right. That's the measure of blood sugar control over time, right? What does this mean for those individuals who aren't meeting those targets?
Well, you might be surprised to learn that not hitting those targets
Mhm.
can lead to some serious complications down the road, increasing the risk of heart disease, stroke nerve damage, and even vision problems.
That's concerning. The report also reveals that blood pressure and cholesterol goals aren't being met by many either. It's not just about A1C, it's about a whole range of factors that contribute to overall health.
Absolutely. And what's even more alarming is that the report highlights a significant number of people not receiving the right medications. This raises some serious questions about potential barriers to care.
Yeah, it makes you wonder, is it just a matter of individual choices? Or are there systemic issues at play?
It's definitely more nuanced than just personal choices. Think about things like access to health care, the affordability of medication, and even health literacy. These systemic issues play a huge role in whether people get the care they need.
And the report dives even deeper, pointing out that certain groups face even greater challenges.
That's right. Young people with diabetes, Black individuals, those with lower education, and the underinsured are statistically more likely to be undertreated.
What factors contribute to these disparities? Is it about access, cultural differences, or something else entirely?
It's a complex web of factors. Think about the challenges of navigating the healthcare system if you're young and still developing your understanding of diabetes management. Or imagine the added stress of trying to afford expensive medications if you're underinsured or facing financial hardship.
It's a stark reminder that social and economic factors play a significant role in health outcomes.
And speaking of economic impact, let's not forget the staggering cost of diabetes. Over $400 billion annually in the U.S. alone. It's not just medical bills, it's lost productivity too. This affects all of us, not just those living with diabetes.
This underscores the urgent need for better care models. The report highlights the chronic care model, or CCM, as a powerful framework. For those unfamiliar with this model, what does it actually look like in practice?
It's not just a bunch of complicated jargon, I promise. Think of it as a shift from reactive care to proactive care. Imagine your doctor's office transforming from a place you go when you're already sick to a place that helps you stay healthy in the first place.
That sounds like a major change. What's one key element of the CCM that you think really stands out?
One of the most impactful elements is self-management support. This means empowering individuals to take an active role in their own care. Imagine this. You're not just following doctor's orders, you're equipped with the knowledge and skills to understand your condition, make informed decisions, and take charge of your health.
So it's a shift from passive patient to active participant.
Exactly. It's about recognizing that individuals living with diabetes are the experts in their own experience. They need the tools and support to become true partners in their care.
This all points to the critical role of teamwork, doesn't it?
Absolutely. Collaborative interprofessional teams are absolutely key to delivering truly effective care. Why? Because diabetes impacts so many aspects of a person's life.
It's not just about blood sugar, it's about nutrition, exercise, mental health, and social support.
Exactly. You've got primary care doctors, diabetes educators, dietitians, mental health professionals. They all play a vital role in supporting patients.
And if you or someone you know has diabetes, this highlights the importance of advocating for well-coordinated care.
It's not just about seeing different specialists. It's about making sure everyone is on the same page, communicating effectively, and working together to create a truly holistic care plan.
The report also mentions some emerging models of care that are gaining traction. We've got patient-centered medical homes and accountable care organizations. What makes these models different from the traditional way healthcare is delivered?
These new models are attempting to address the fragmentation that often plagues traditional healthcare. Imagine a system where your care is seamlessly coordinated, communication is streamlined, and everyone involved is focused on your individual needs and goals.
That sounds like a breath of fresh air. Which of these models do you find particularly intriguing?
Personally, I'm fascinated by patient-centered medical homes. They really emphasize a comprehensive, coordinated approach that revolves around the patient's needs and preferences. It's a shift from a disease-centered model to a truly patient-centered model.
And then there's telehealth, a topic that's been generating a lot of buzz lately. What insights does the report offer about the future of telehealth in diabetes care?
Telehealth is definitely here to stay. Think video conferencing with your doctor, remote monitoring of your blood sugar, and even virtual diabetes education programs. It's all about leveraging technology to make care more accessible and convenient.
That's especially important for people in rural areas or those who have difficulty getting to in-person appointments.
Exactly. Telehealth can break down geographical barriers and offer greater flexibility for patients. But it's important to remember that it's not intended to completely replace in-person care.
Right. It's more about complementing traditional care and offering additional options for patients.
Right. Telehealth could be a game changer for certain aspects of care, but it's not a one-size-fits-all solution. It needs to be integrated thoughtfully into the overall care plan.
So we've talked about individual care and teamwork and emerging care models like telehealth, but what about the bigger picture? What needs to change at a system level to truly move the needle on diabetes care?
That's where we really get into the nitty-gritty of transforming healthcare. We have evidence-based guidelines, but the question is, are they being implemented consistently? And how can we leverage teamwork data and technology more effectively?
It seems like there's a gap between what we know works and what's actually happening in practice. What are some of the roadblocks preventing these evidence-based guidelines from being fully embraced?
One of the biggest challenges is inertia within the system. Changing ingrained practices and workflows can be like turning a giant ship. It takes time, effort, and a willingness to embrace new ways of doing things.
And of course, we can't ignore the elephant in the room, cost barriers.
The high cost of medications, especially insulin, is a major obstacle for many people. Imagine being prescribed a life-saving medication but being unable to afford it. It's a heartbreaking reality for far too many individuals.
The report does mention some efforts to address this, like the Part D senior savings model and state-level insulin copay caps.
These are positive steps, but it's an ongoing battle. The senior savings model caps insulin costs from Medicare beneficiaries, which is a huge win for seniors struggling to afford their medication. And state-level efforts are aiming to make insulin more affordable for those with commercial insurance. But we still have a long way to go to ensure affordable access for everyone who needs it.
This is where advocacy becomes so important. We need to keep pushing for policies that prioritize affordability and access to essential medications.
Absolutely. And even when people have insurance, access to care can still be a problem.
So just having that insurance card doesn't guarantee smooth sailing. What are some of the other barriers people might face?
Imagine living in a rural area where there's a shortage of healthcare providers. Or maybe you rely on public transportation and struggle to get to appointments. Or perhaps you work multiple jobs and can't afford to take time off for doctor's visits.
These are the often invisible barriers that can make accessing care incredibly challenging, especially for those in marginalized communities.
That brings us to another crucial aspect highlighted in the report: social determinants of health, or SDOH.
We hear that term a lot these days. For our listeners who might not be familiar, can you break down what social determinants of health actually are and how they impact diabetes care?
Think of it this way. Your health isn't just determined by your genes or your choices. It's also shaped by the conditions in which you live, work, and play. Factors like access to healthy foods, safe housing, reliable transportation, and social support networks all play a huge role.
So it's about recognizing that health is influenced by a whole range of factors, beyond just what happens in the doctor's office.
Precisely. And when it comes to diabetes, these social and economic factors can make a world of difference in how well someone is able to manage their condition.
Can you give us a concrete example of how something like food insecurity might impact diabetes management?
Imagine trying to follow a healthy eating plan when you're struggling to put food on the table. or living in a food desert where fresh produce is scarce and expensive. Or picture yourself trying to manage your blood sugar when you're constantly stressed about making rent, or keeping a roof over your head.
It's a stark reminder that we can't separate health from the social and economic context in which people live.
And that's why the report places such a strong emphasis on addressing SDOH. It calls for healthcare systems to go beyond treating symptoms and start addressing the root causes of health inequities.
That sounds like a tall order. How can healthcare systems realistically tackle these complex social and economic challenges?
It starts with acknowledging that SDOH are a critical part of the healthcare equation. We need to routinely screen for these factors using validated tools and have clear pathways to connect people with resources that can address their needs.
We've talked about some promising examples, like food prescription programs and initiatives to provide stable housing. The report seems to suggest that these types of programs need to be scaled up and integrated into healthcare systems.
That's one of the key recommendations. We also need to ensure that care is culturally and linguistically appropriate, recognizing that diverse communities may have unique needs and preferences.
It's about moving beyond a one-size-fits-all approach and tailoring care to the individual within their social context.
Absolutely. And speaking of tailoring care to individual needs, the report dives deep into the importance of health literacy and numeracy.
Those terms might sound a bit technical. Can you explain what they mean in a way that everyone can understand?
Think of health literacy as the ability to find, understand, and use health information to make informed decisions about your health. It's about being able to navigate the healthcare system, understand medical jargon, and apply health information to your own life.
So it's more than just being able to read pamphlets or websites. It's about truly grasping the information and feeling empowered to use it.
Exactly. And numeracy is the ability to work with numbers and understand health statistics or data. It's about feeling comfortable interpreting things like blood sugar readings, medication dosages, and nutritional information.
Why are these skills so important for people with diabetes?
Diabetes management often involves a lot of numbers, calculations, and complex information. If you struggle with health literacy or numeracy, it can make managing your condition incredibly challenging.
It's like trying to solve a puzzle without all the pieces or instructions.
That's a great analogy. And unfortunately, the report highlights that many adults struggle with these skills, which can create a significant barrier to effective self-management.
So what can be done to address this challenge? Is it about better education, more user-friendly resources, or something else entirely?
It's a multifaceted approach. We need healthcare providers who communicate clearly and avoid medical jargon. We need educational materials that are easy to understand and tailored to different learning styles.
It's about meeting people where they are and providing support that empowers them to take charge of their health.
And it's not just about individual patients. We need to improve health literacy at a population level. That means investing in educational programs, making health information more accessible, and advocating for policies that promote health literacy as a fundamental right.
This highlights the interconnectedness of everything we've been discussing. It's not just about individual responsibility. It's about creating a system and a society that supports health and well-being for all.
And speaking of support, the report dives into the crucial role that social capital and community support play in managing chronic conditions like diabetes.
What exactly do those terms mean, and how do they factor into the equation of diabetes care?
Social capital refers to the networks of relationships and connections that people have. It's about trust, reciprocity, and a sense of belonging. Think of it as the glue that holds communities together.
It's that feeling of being supported, knowing you have people you can rely on, and having a sense of connection to something larger than yourself.
Exactly. And research shows that people with strong social capital tend to have better health outcomes.
That makes intuitive sense. If you're surrounded by a supportive community, you're likely to feel more empowered to take care of your health.
And on the flip side, social isolation and lack of support can make managing any chronic condition, including diabetes, much more challenging. Imagine trying to navigate the complexities of diabetes management while feeling alone and isolated.
It underscores the importance of fostering connections and building supportive communities.
The report highlights the role that families, friends, and support groups can play, but it goes beyond those personal networks and emphasizes the importance of community-level support as well.
What would that look like in practice? Are we talking about community health centers, faith-based organizations, or something else entirely?
All of the above. Think community health centers that offer diabetes education programs and support groups. Imagine faith-based organizations providing meals or transportation assistance to seniors with diabetes. Picture local initiatives that promote healthy eating and active living in underserved communities.
It's about creating an environment where people feel supported, empowered, and connected to resources that can help them thrive.
And the report highlights a valuable role that community health workers and peer supporters can play in bridging gaps in care.
Who are these individuals, and what makes their role so unique?
Community health workers are trusted members of the community who provide education support and navigation assistance. They often come from the communities they serve and have a deep understanding of the challenges people face.
They act as a bridge between the healthcare system and the community, helping people navigate complex systems and access resources.
And peer supporters are individuals who have lived experience with diabetes and can offer guidance and encouragement to others. There's something incredibly powerful about connecting with someone who understands your journey firsthand.
That peer-to-peer support can be so valuable, especially when it comes to managing a chronic condition like diabetes. It's that sense of, I've been there, I understand what you're going through.
Exactly. These individuals can make a world of difference in helping people feel less alone, more empowered, and more connected to a supportive community.
So we've been talking about building this web of support, from individual empowerment to community resources to system-level changes. It's clear that effective diabetes care requires this multifaceted approach. But what about specific populations that face unique challenges? What insights does the report offer about tailoring care to diverse needs?
You're right, it's not a one-size-fits-all situation. The report dives deep into the challenges faced by specific groups, like refugee, migrant, and seasonal agricultural workers. These individuals often encounter multiple barriers to accessing quality healthcare.
Yeah, we've talked about the social determinants of health, and I imagine these factors are amplified for these populations.
Absolutely. Think about language barriers, cultural differences, lack of stable housing, limited transportation options, and even fear of accessing healthcare due to immigration status. It's the complex intersection of challenges that can make managing a chronic condition like diabetes incredibly difficult.
It sounds like healthcare systems need to be much more proactive and culturally sensitive in reaching these communities.
The report emphasizes the need for tailored outreach programs and services that meet these individuals where they are. Instead of expecting them to navigate a complex system that may feel unfamiliar or even intimidating, we need to create welcoming and accessible pathways to care.
What might those pathways look like? Are we talking about mobile clinics, multilingual staff, or something else entirely?
Think about partnering with community organizations that have established trust within these populations. Imagine offering healthcare services in locations that are familiar and convenient, like community centers or places of worship. And of course, ensuring that language access is a priority, with interpreters and translated materials readily available.
Yeah, it's about removing those barriers and making healthcare a truly welcoming and inclusive space.
Exactly. And the report also sheds light on the specific needs of another often overlooked group, older adults with diabetes.
As people age, they face additional challenges. I imagine managing diabetes becomes even more complex.
You're right. Think about mobility limitations, cognitive decline, social isolation, and potential financial constraints. These factors can significantly impact an older adult's ability to effectively manage their diabetes.
It sounds like we need a more holistic and compassionate approach to diabetes care for seniors.
The report highlights the importance of geriatric-focused care that takes these factors into account. It's not just about managing blood sugar levels. It's about understanding the whole person and their unique needs.
What would this type of care look like in practice?
Imagine a care team that coordinates seamlessly between specialists. Think about home-based support services that help seniors manage their daily tasks and medication regimens. And consider programs that address social isolation, like senior centers or community-based activities, to foster a sense of connection and well-being.
Right. It's about recognizing that diabetes care for older adults needs to be as much about quality of life as it is about medical management.
Absolutely. It's about supporting individuals to live their best lives, even as they face the challenges that come with aging.
This deep dive has been incredibly enlightening. It's clear that the future of diabetes care is about so much more than just numbers and medications.
It's about understanding the whole person, their social context, their unique needs, and empowering them to be active participants in their own care.
It's about breaking down barriers, fostering connections, and creating a healthcare system that is truly equitable and accessible for all.
I think the ADA's standards of care provide a roadmap. But real change happens when we all work together, patients, providers, and communities, to create a more compassionate and effective healthcare system.
This brings us to the end of our deep dive into the future of diabetes care. I hope you feel equipped with a deeper understanding of the challenges, the opportunities, and most importantly, your own power to make a difference.
We encourage you to continue learning, asking questions, and advocating for a healthier future for everyone.
Thanks for joining us, and until next time, keep diving deep.